Okay. So, hi, Tim. Tell me what's been going on for you lately.
So, a number of things at the moment. So, I've just done a talk at a conference that seemed to go quite well. I'm conscious I've got a holiday kind of coming up, and I suppose there's lots of stuff going on, and I suppose I'm a bit conscious there's things I just need to get done before the holiday, and so that's feeling a little bit kind of it's feeling like there's quite a lot going on at the moment. Yeah.
Oh, a lot going on. It sounds like you might be a little bit stressed out.
Yeah, I suppose it is stressful, isn't it, when there's lots going on and you don't feel like you've got enough time. Yeah.
Okay. Yeah. I mean, and stress can be an issue, can't it? Are you finding the stress is sort of building up for you at the moment?
Yeah, I would say the stress is building up. Yeah, which is, it's not that comfortable.
Okay, cool. Well, I mean, that's an area where health coaching can really help. We're really good with stress management. Um, I mean, we've got some really good resources that I could connect you with. I don't know. Do you think you need to sort of go to some talking therapies or talk it through, or is this something you think you can do yourself?
Well, I don't really know. Resources, you said resources, talking therapists, don't really know what do you mean by that?
Well, when people are stressed, you can either sort of, do some self-management yourself. I could recommend some really good books or connect you with some really good websites. Or sometimes people like to talk it out with somebody. We call that talking therapies. And I can organize for a referral for you there.
Well, I suppose what I'm thinking is I've got quite a lot on already, and naturally going and seeing someone else or trying to fit something else in, or even reading a book, I just think, to be honest, I haven't got time for things I'm doing right now, let alone adding something else back in.
Well, yeah, but the trouble is though, if you let stress get on top of you, it can really, you tend not to eat well. I don't know what, I mean, are you doing much else to look after yourself? Are you managing to find time for exercise?
Not finding time for anything really. I mean, I'm working, I'm working hard. But yeah, I suppose not doing loads of stuff at the moment to look out for myself or look after myself. I think that's probably true, but I haven't got time. I mean, that's the point. If I
But
had time, I'm sure I would do all those things.
but don't you see what I mean? When you're stressed, when you're not managing your stress properly, you find that you stop looking after yourself. You're probably not sleeping very well either, I suspect, and you end up eating poorly, not doing the things that you look after yourself. So if you don't get on top of the stress early, it can just, snowball out of control.
Yeah, well, I can see that, and that might be, I suppose, for other people, that might be something that happens. But yeah, I suppose, yeah, I just can't get past the fact that I haven't got time to do all the stuff that you seem to be suggesting there. So I don't know. I don't know. What other thoughts have you got? What else could I do?
Um, well, I mean, you could go and talk to your GP. I mean, sometimes if things are really getting out of control, then some medication could help. But it doesn't sound to me like you've got to that stage. I mean, I really think you'd be good at some sort of self-help sort of things. There are some really good websites I could send to you. You can have a think about it, but I think those sort of things, in my experience, are really useful for people like you, where stress is starting to, creep in.
Okay. I mean, I can't promise anything because as I said, I'm not sure if I've got time to do it. But if you send me the stuff, then I suppose, if I find a moment, then I could have a look at that, I suppose. Yeah.
Yeah, of course. I mean, it's just something to think about, isn't it? I don't want to pressurize you too much. It's always your choice, But yeah, okay, I'll send those across to you and see how you go. And maybe we can catch up in a couple of weeks and see what you've made of it.
Yeah. Okay. Okay. Maybe. Yeah. Maybe.
Brilliant. Lovely talking to you, Tim.
Yeah. And you. Thanks, Ollie. Yeah.
So, hi, Tim. So, what's been going on for you recently?
Well, there's a lot going on. I've just done just spoken at a conference. That went well. I've got a holiday coming up, so yeah, so it's feeling quite busy because there's lots of stuff that I'm aware of I need to get done before I go on holiday. And I suppose there's always that kind of when you come back from holiday as well, there's always lots to do. So I'm feeling a little bit like there's a lot going on.
Feeling like there's a lot going on at the moment.
Yeah, exactly. Almost too much, really. And it's not feeling comfortable, I would say.
Okay. Yeah, you're not feeling comfortable, not on top of it. Tell me a little bit more about it.
Well, I mean, there's a number of courses that we're kind of currently developing. There's making sure that we're getting people on the courses that we've already got. There's my children, one of them's going off to America to kind of for a few months. My other children are kind of going abroad as well with school for a number of weeks. So that's all. They all need to get stuff sorted for them. And there's the work stuff. And then, and again, it's just not much time for myself, not much time for my wife, my Alison. So there's lots, and it feels like too much.
Feels like too much.
Yeah.
Yeah. Okay. Is there anything else going on at the moment that comes into play?
Yeah, well, we got a new, fairly new puppy. I live with my mum, so she lives with us in the home, and yeah, so that puppy's mainly for her. So again, yeah, Alison's having to go out for puppy training with her tonight, and the kids are off doing their own stuff tonight as well with their explorers group, and yeah, and then I'm going to take my son to the airport tomorrow. So there's feels like there's lots and lots of people needing me and my attention, I think.
Yeah, no, I hear that. So loads on. Is this something you're on top of, or is there something that we can work on together here? Do you feel like there's something you need to do about things at the moment?
Yeah, well, it's not feeling comfortable. So I suppose there's an element of it's feeling a bit too much, so more than I'm used to. And so I think it would be useful to think a little bit about that because it is feeling a little bit overwhelming at the moment.
Okay. And have you had any thoughts around things you might do to help?
Well, I suppose, when I have had situations which are similar to that, to this in the past. I think there's times when I've just taken a bit of time for myself at the beginning of the day and the end of the day. And I suppose when I've done that previously, I think that's worked quite well. So whatever happens in the rest of the day, just having those, even if it's like 5 minutes or 10 minutes, I think that's worked quite well for me. So it's probably things like that that I could probably put in again.
Just finding 5 or 10 minutes for yourself.
Yeah, and that might be just sitting quietly, or it might be just going for a walk, or yeah, I don't think it matters necessarily what. I think the point is that I'm not doing stuff with other people for that period of time.
Mm. Yeah. So sounds like it's worked for you in the past. Tell me a little bit more about when that worked well for you in the past. Was it in a similar situation to this?
Yeah, well, I'm thinking it's when I was working as a GP partner, and there were long hours, and I was getting in early, I was leaving late. There was no time in the middle of the day. It would just felt kind of things just going like that, really. And so I think it may have been Alison that suggested actually you just need to take some time for yourself, which was good to have that permission. So that was one thing, permission. But then just having that time at the beginning and having that time at the end just allowed the other stuff to kind of feel okay. Yeah.
So just finding some time at the beginning and the end of the day really helps you.
Yeah, I think so. I'm not saying that's everything necessarily, but definitely that was helpful.
Yeah. Okay. And have you got other thoughts, other things that you think might be useful in this sort of scenario?
Well, I think there's something for me that's worked well about kind of planning time in. That's what I'm thinking about. Some planning some time in, some planning some gaps.
Mhm.
So, I know if I have a gap planned in the diary, it's much more likely to happen. So, um, I think that's good, but also not just planning the gap, but planning what I'm going to do in that gap, with someone. And I think that's quite good for me to have them, yeah, to have them in the diary. Yeah.
So planning a gap. Tell me a bit more about that. What does that gap look like?
Well, it might be just meeting up for a coffee, or it might be meeting for a walk, or it might be just having a conversation, like this. Or I do have other people that I do, have a bit of a think with every so often. So maybe planning those in regularly. So I had almost those like fire breaks. It kind of feels like to me that's what's come to me now. It's almost like to have these fire breaks, but they're planned in, so I know they're going to happen.
Okay. Yeah. So there's a couple of things you said there. And have you got any other thoughts about things that might work well for you?
I mean, there's something a little bit that's coming to me about my diet and nutrition, and I could probably do with getting back into fasting. I did that a little bit. And I think when I had good nutrition, I also slept a bit better. And I think that's another thing that could do with improvement.
Mm.
I don't want to do too much at once, but it's those are the other things that I'm thinking about down the line. So nutrition and getting a good night's sleep.
Yeah. Okay. Well, I know we only had a short time for a conversation today, Tim, and there's a couple of things three ideas I've heard there for you. Some, top and tail in the day with a little bit of time to yourself, even if it's just 5 or 10 minutes. Um, finding some planning some gaps in your diary. And what was the last thing you said there? Just remind me
Well,
again.
it was thinking maybe for the future about kind of nutrition and sleep. I suppose those kind of things would be important.
Yeah. And those are things that you've done before and would know where to start.
Yeah, I might. They might need a bit more work down the line, but I think there's definitely more I could do about that. Yeah.
Lovely. Well, look, we've only got a short time. Let's leave it there today. But it sounds like you've got a few things to think about. Is it worth us just catching up to see how you're getting on, progressing some of these things?
Yeah, and I think, just think about the things that I could probably start with just doing the gaps, to be honest. I mean, the gaps at the beginning and the end of the day, I could definitely do those and planning some gaps in the diary, although that does depend on other people. So definitely I could do the top and tailing of the day, and maybe I could check in with you and just that might be quite good accountable, to be accountable. But a bit about that, how I'm getting on with those. Yeah.
Yeah, great. Oh, you seem a little bit more upbeat about it. I can see you've
Mm.
got some ideas brewing in your mind. So keep those going. And yeah, I'll give you a ring in a couple of weeks and see how you're getting on with those sort of things, or anything else that might come to mind as you start to think about managing your situation.
Yeah, great. Thanks, Ollie. That's been really helpful. Thank you.
No worries. Nice to speak to you, Tim.